Good morning, everybody. Will Dupree here in the KXA live studio. Thanks so much for joining our stream. We are about to listen in to a news conference that's being held virtually with a nurses union. Some of the registered nurses in El Paso are going to be speaking against an appeals court blocking the El Paso County judge's stay-at-home order that he issued through December 1st to try and curb the spread of COVID-19 in that community. Let's take a listen as this new press conference gets underway there in El Paso.
We will be calling on you, and the way you can get our attention is through the raise hand function, and we'll be calling on you for questions. Again, thank you guys very much, and we'll go ahead and start. We have Ariana Lucio, registered nurse from HCA-owned Del Sol Medical Center, who currently works in the COVID unit, caring for med-surg patients.
Hi, yes, my name is Ariana Lucio. For spelling purposes, it's A-R-I-A-N-A, last name L-U-C-I-O. I've been a nurse for 8 years now. The majority of the time I've been at Del Sol, and I'm working on the med-surg unit with COVID patients right now. I just wanted to convey to the community and the press how disappointed and concerned we are that the stay-at-home order was struck down last night. We found out about it. I wanted to talk a little bit about how the last month has been just so overwhelming on all the hospital staff, doctors, nurses, CNAs, techs, and not to mention the community, the impact it's having on El Paso. We've seen several units converted from regular units to COVID units starting in October. One day you'll go in and the next day, okay, this unit is now COVID unit. It's just been very life-altering, and it's taken a very emotional and physical toll on the nurses and doctors, everybody. I think we need to remember that these patients that we're seeing are alone. They can't have visitors. And I think that's the hardest part about this disease, is that some people won't ever see their family members again. That, you know, that time when they go in, it might be the last time they see them. I wanted to encourage the community to try to stay home as much as possible. Continue wearing masks. Even though the order was shut down, I believe we should still try to take our own accountability and do as much as we can to help stop the rise of the COVID cases here.
Thank you, Ariana. And again, you know, as El Paso has become the epicenter of this COVID crisis, it's very important to hear from frontline healthcare workers, but also about community champions and community members who are taking this seriously. I would like to welcome Alejandra Anello, who is the District 2 Council member.
Hi, thank you guys so much. Yeah, again, my name is Alexandra Anello. I am the El Paso City Representative for District 2, and I want to thank you all so much for including me in this extremely important event. It's a real honor to be here with the men and women who put their lives on the line every day that they go to work and who are fighting to keep our community safe. It is these very healthcare experts who understand this pandemic better than anyone, and who all public officials need to be listening to in order to make sound public health decisions in the midst of this deadly pandemic. It is extremely disappointing that politics are leading our response to COVID-19. and County Judge Samaniego's stay-at-home orders were a common sense measure to respond to what we are experiencing in our community. For any elected official to intervene in blocking these orders is dangerous and will only result in more deaths in this community. While it is unfortunate that our medical providers must file an amicus brief to be heard, I am so proud of National Nurses United for stepping up and making their voices heard, to encourage the court system to heed their call to keep frontline workers and El Pasoans safe during these unprecedented times. Despite any court ruling, I really want to just remind all El Pasoans to continue social distancing, wear a mask, wash their hands, and while it's difficult, especially during this upcoming holiday season, to stay home and to only interact with those living in their households. Again, I want to take a second to applaud all of the nurses, all of our healthcare workers, frontline medical, fire, and law enforcement professionals for working tirelessly to combat this deadly virus. I also want to thank all of the small business owners who have really taken an understanding to what's happening and put this community first. Thank you guys so much for everything that you're doing.
Thank you, Councilmember Anello. Next, I'll introduce Idali Cooper, who is also a registered nurse here locally, to give you a few thoughts as well.
Good morning. Thank you for having me here. My name is Idali Cooper, Idali Cooper. I am here today. Well, I have been a nurse more than 20 years. I've worked in a couple of hospitals locally. I just wanted to share much, as a nurse, as my experience, how and express my disappointment in the court's decision, especially in a community that is really, we are the majority as Hispanic people, and we have been affected the most. And not only, this pandemic has affected people of color, which includes us Hispanics and also African Americans. Actually, there's some statistics at this time where there was like 55% of our Hispanic people have died of COVID-19 and 11% African American. So I just wanted to express the importance of our voices to be heard as a Hispanic community, because we are being affected here. We are ground zero, as we are the epicenter of what's going on. Our community, or El Paso, has had the most hospitalizations of patients compared to the rest of our country. So it is imperative to inform our governor or attorney general that their decisions have dire consequences for my community or for communities of color. So of the 213 nurses that have passed away, 124 have been nurses of color, and we are experiencing something that we've never experienced in the hospital before. I know this past weekend, I work with pediatric ICU patients. This weekend I did work with COVID patients, and I'm exhausted. I mean, I'm just extremely exhausted emotionally, physically. I haven't recovered. I have to go back to work tomorrow. I have not recovered. I feel I've been napping all week, and knowing that my patients are being intubated, it's very demoralizing. And I just want the community to know that it's very important for all of us, even though our governor and attorney general did not do the right decision for our community, that we do what's right for our community, regardless of what they say. Right now, in the adult units, there's not enough nurses for all the patients that are that need to be taken care of adequately. They are taking more patients than they should. So please stay home, wear your masks, do social distancing, do everything you need to do so that way we can keep all of us safe. And us as a community, as a Hispanic community, we have elderly people living with us. We are not, we have an extended families. We have grandmas and we have parents. And don't forget that this virus not everybody shows symptoms. So that's the most dangerous thing that there is right now. The young people can come home and bring it and have no symptoms, and you bring it to your parents and you bring it to your grandparents, to your abuelitas and abuelitos. Please be conscientious of everybody that is around you. So it is I'm just like very disappointed with our officials that they're not, they don't even know what we are going through. And this decision was very irresponsible and very insensitive to the needs, not only of our community, but of our healthcare workers. It is obvious to us, they have no clue what we are going through in the hospitals. I welcome them to come and work with us and go through what we go through every single day when we have to take care of COVID positive patients and we see that they can't breathe or that that they're in desperation, that they're like they can't move or they're afraid to move because they're afraid to stop breathing. Thank you so much for allowing me to have this moment.
Thank you so much for sharing that, Idali. Next, I will introduce Juan Anchondo, who's a registered nurse and the chief nurse rep of National Nurses Organizing Committee, NNU, at Las Palmas Medical Center. Juan?
Hello, like Mateo said, my name is Juan Anchondo. It's JUAN-ANCHONDO. I have been working at Las Palmas for the past 17 years. And I am a member of the National Nurses United Union since 2010. Proud member. So we are mourning today for our patients, for our neighbors, and for our community over the injunction issued by the court blocking stronger safety measures for El Paso. This order is especially a disaster for our healthcare system, which is in near collapse here in El Paso. From the calamity just ripping through our facilities every day. I work at the med-surg unit, and I get floated quite often, our colleagues on our unit, to the COVID floors. So I've seen firsthand what it does. And it's very real, because we always hear these things about, it's not real, no, yeah, it's real. People need to take this much more seriously. And more patients are dying every day, and we are not able to keep up. Our own lives and our own families are also in jeopardy. We can potentially bring this stuff home. And more than 50 RNs in El Paso County have already been infected with COVID-19. I'm sure possibly more than 50. So our hospitals are running beyond a safe capacity. Since early in this pandemic, my hospital at Las Palmas converted its 4 North section to be dedicated as a COVID unit. And however, the need for the COVID beds has overwhelmed availability in the dedicated unit to where patients were in private rooms, and within the last few weeks, they had to be turned into double beds, the double occupancy, just to bring up more capacity, bring up the capacity. It's that bad. So all non-ICU patients who are COVID positive or suspected of being so were housed in the 4 North unit. And in recent weeks, however, the need for these COVID beds were overwhelmed. Oh, I'm rambling on. So in the last 3 weeks, the first dedicated unit converted for COVID beds at the start of the pandemic has been overwhelmed. So next, once that unit was overwhelmed, they started using other floors, like the oncology unit, the telemetry unit, were all converted to COVID dedicated units. And also partially the pediatric unit was also converted to COVID, to house COVID patients. So that means the entire floors of the hospital were been emptied for their former patients, which consisted of potentially pediatric patients and those in need of cancer care, in order to make room for the COVID positive patients who need it, who need care. See, like more COVID patients are coming than just regular patients now. You know, where are these other patients going to go to get their care, you know? Other hospitals lack the physical infrastructure necessary for the massive upsurge. So in some cases, lacking negative pressure rooms or air filtration systems that are required to prevent the spread of COVID through the hospital's ventilation systems. And these makeshift units, there is no barrier to prevent the contaminated air from COVID positive patient rooms from spreading throughout the hospital and exposing hospital employees and patients to the infection. It's concerning. The scarcity of physical capacity is not limited to the hospitals themselves. One unfortunate duty of RNs is to call funeral homes to retrieve the bodies of patients who have died at the hospital. RNs are finding that funeral homes have reached capacity during this spike. You know, spike in El Paso is seen right now. So the hospitals are running out of supplies and lack of adequate equipment. So caring for patients with infectious diseases requires optimum life-saving personnel protective equipment, which is the PPEs. Preventing the spread of COVID-19 to healthcare workers is absolutely critical. Because without us, you know, who's going to take care of the sick? So it's absolutely critical to avoiding catastrophic collapse of the healthcare system. PPEs are required. Yet RNs and other healthcare workers are facing rationing of these PPEs as the supplies dwindle. So RNs are given only, right now, N95 masks are being used for just for the entire shift. That's what all of us are experiencing. You know, you only get one N95 to use per shift of a 12-hour shift. It's disheartening. You know, okay, so this is a significant departure from the norm and safe practice, which is the use of an N95 every time, use of a new N95 every time the RN enters an infected patient's room, and it's to discard it upon exiting. You know, that was the norm before the pandemic. Now, you know, these masks, they're supposed to be for single use only. You go into a patient's room with a new N95, take care of the patient, you come out, you discard it. That is gone. Those times are gone, you know, since the beginning of this pandemic. So RNs are also using masks that have not been properly fitted or fit tested and do not offer adequate protection. So hospitals are limited access to PPEs, but keeping supplies under lock and key. We see this a lot. This creates dangerous delays as RNs have to seek out a supervisor to give them the needed equipment before entering a patient's room. And sometimes that's a delay in care. That's not acceptable. So hospitals have cut back on testing patients and employees for COVID because of the lack of required supplies. So hospital staffs have had to resort to using BiPAP machines because there was not enough ventilators for all the patients who needed them. You know, we see this a lot, you know, the lack of ventilators. We heard in the beginning of the pandemic when everything was happening up in New York, you know, what were they needing? Ventilators. Now we're having to use the stuff that's like BiPAPs instead of a ventilator. And hopefully that'll work for the patient. So staffing levels are well, you know, we know of one heartbreaking case where the hospital staff were put into unthinkable situations of needing to urge a family to approve withdrawal of care from their loved ones because the ventilator keeping that person alive was needed for another patient who had a better chance of survival. This worst case scenario is the current reality here in El Paso County. So staffing levels. The staffing levels are just deplorably insufficient. FEMA has sent RNs, which is great, and other hospital staff to supplement local staff, which we need desperately. But even with FEMA nurses present, staffing levels in the ICU are critically deficient. You know, I hear, you know, maybe maximum you should have no more than 2 patients in an ICU setting, but nurses are constantly given like 3 to 1 assignments, and that's really that's a bad scenario. You know, typically ICU nurses care for just one critically ill patient at a time, and like I said, you know, they've been getting tripled. And even one FEMA nurse even described the situation here in El Paso as worse than New York, if you can just believe that. And the spike in COVID cases has taken a psychological toll on many RNs, my fellow coworkers. They describe seeing their patients vibrant and lively and one day and only to deteriorate rapidly and pass away. I've experienced it. I have many stories, but that's for another time. So RNs report wondering whether their declining patients will ever hug their loved ones again. And they're having to facilitate final goodbyes to their family members via cell phone or FaceTime. It's a sad reality of what's going on, especially in the critical care units like an ICU. This situation is unsustainable. And it's going to get worse if we continue to set new records every day in infections, hospitalizations, and deaths here in El Paso County. With our governor, our attorney general, and the court as accomplices to this tragedy. Please support our Judge Samaniego. Yeah, that's all I have to say.
Thank you so much, Juan, for giving us a look at what the conditions are inside these hospitals. Next, we have Ariana, who will be coming back on to say a few words in Spanish as well.
Sí, quería para la comunidad que habla español también introducirme. Mi nombre es Ariana Lucio. Llevo 8 años de enfermera, casi siempre en Del Sol, trabajando en la unidad de pacientes médicos y quirúrgicos, que ahorita son pacientes COVID. Quería decir que estamos muy decepcionados con que hayan parado la orden de queda en casa. Ahorita, ayer nos enteramos y los trabajadores en el hospital estamos muy decepcionados porque las condiciones como están ahorita están muy feas en el hospital. Estamos llenándonos ya de pacientes con el COVID. Hasta tenemos ya carpas afuera del hospital porque ya no, los pacientes ya no caben en el hospital. Como estaban mencionando los otros enfermeros, muchas unidades ya se han convertido a estrictamente pacientes COVID. Ya los pacientes que no tienen COVID son muy pocos. Y yo creo que no están yendo algunos pacientes al hospital por temor a enfermarse del COVID. Y quién sabe cuánta gente se está quedando en casa y no tratándose, porque estamos tan llenos en el hospital que ya la capacidad, ya estamos arriba de la capacidad. Esto es muy triste porque los pacientes ya no logran ver a su familia, ya no pueden tener visitantes, como antes de que podían ir a verlos a sus familiares y estar ahí como un apoyo moral. Ahorita eso ya nada más por teléfono se pueden ver a los pacientes. Es muy triste cuando los pacientes están muy enfermos y nosotros teniendo que decirle a la familia por teléfono, tu familia está deteriorando, tu familia tal vez lo vamos a entubar. Y claro, afecta mucho a la comunidad, afecta a todos aquí en El Paso y Juárez también. Y afecta mucho a los enfermeros y a los doctores, a los asistentes de enfermero, a todo mundo afecta porque se siente uno que no podemos ya dar más. Hacemos todo lo que podemos para ayudar, pero llega un momento en que es todo lo que pudimos dar. Y por eso estamos suplicando a la comunidad que nos sigamos quedando en casa, nos sigamos usando máscaras. Aunque no, ahorita no, ya no está la orden en lugar. Eso es política. Eso no tiene que ver con una comunidad hispana. Y no juntarnos. Yo sé que somos una comunidad muy familiar, que nos gusta mucho juntarnos con nuestros primos, abuelitos, pero ahorita no es el momento. Ahorita tenemos que pensar en el futuro. Y la única manera que vamos a sobrevivir esto es aislándonos mientras llega la vacuna. Y esto va a ayudar a mantener a nuestros familiares sanas. Y ya después ya nos podemos juntar otra vez, pero ahorita no es el momento. Ahorita nada más hay que salir para necesidades esenciales. Y queremos el apoyo de la comunidad en esto y para seguir pidiendo a la gente en la política que piense en la comunidad. Claro que también pensamos en los negocios, pero ¿qué negocio va a haber si no hay gente, si todos estamos muriéndonos? Bueno, y eso es lo que yo quería pedir también aquí. Gracias.
Thank you very much. We will, let's see, we'll have some time now for a few questions from those of you from the media. We have maybe 2 or 3 questions. Please use the raise hand function so we can call on you for questions. Okay, I see a few hands going up. I'll see Stephanie Cordobos.
Can you hear me?
Yes, we can.
Okay. I'm going to ask a question in Spanish. I'm a news reporter for Univision in El Paso. Quería preguntarle a Ariana o a otra enfermera que hable español que nos explique un poquito más lo que se ve día con día dentro de los hospitales al tratar a pacientes con COVID y un mensaje para todos aquellos que creen que lo que está pasando aquí en el condado del Paso no es una realidad?
Sí, muy buena pregunta. Am, Creo que la concepción que tienen, que tal vez está equivocada a veces, es que esto nada más afecta a pacientes mayores. Desafortunadamente, aquí en El Paso y en Juárez tenemos una comunidad que tiene muy altos enfermedades que los pueden predisponer para que se pongan enfermos, más enfermos con el COVID. Por ejemplo, tenemos mucha gente con diabetes. Eso parece ser los dispone a que se pongan más enfermos con el COVID. Y yo he visto muchos pacientes jóvenes que tal vez nada más tienen asma y están muy enfermos con el COVID, requiriendo oxígeno, que no apenas pueden caminar. Y estoy hablando de gente de veintitantos años. No nada más, sí, la mayoría son gente más grande, los que se ponen muy críticos, pero nos está afectando a todos, no nada más es los mayores de edad. A veces entramos un día a trabajar y tenemos nuestros pacientes, empiezan, por ejemplo, con una mascarilla simple de oxígeno, de 5 litros de oxígeno, y ya al final de tu turno ya los tienes con 15 o a veces más, ya los tienes que poner en lo que se llama un high flow y ya listos para meterse el BiPAP. O sea, se deterioran muy rápidamente los pacientes y por eso las enfermeras tenemos que estar muy al pendiente de esos pacientes. Necesitan mucho más cuidado de los pacientes que nosotros estábamos acostumbrados a cuidar antes. Antes teníamos pacientes que pues podían caminar solos sin tener que vigilarlos y ahorita no es el caso. Ahorita los pacientes ya están más enfermos. Todos los pacientes de COVID están mucho más enfermos que los pacientes que veíamos antes. Requieren mucho oxígeno. Algunos no pueden ni caminar, o sea, la situación está muy grave. Y quiero que la comunidad trate de imaginarse esto, de que yo sé que no lo pueden ver porque pues estamos nosotros en un hospital cerrado, pero creo que ya en este punto todos conocemos a alguien con COVID y todos conocemos a alguien que falleció de COVID. Entonces a mí se me hace que ya la gente ya se está dando cuenta de la situación, porque ahorita ya a todos nos está afectando desafortunadamente. Gracias.
All right. Next we have let's see, Tanya Barba. And please say which media outlet you're joining us from. Thank you.
Hi, this is Tony with KFOX and CBS4. I had a question. We were hearing the nurses are going through here in El Paso, but what kind of help are they getting outside of that? Are they is the hospital providing them just someone to talk to, working with emergents? How is that working?
I'm not really sure how that is working at this time. I just know for a fact that I haven't been personally asked if I could, I know that, well, I had a coworker that passed away from COVID in the beginning of this pandemic. We did get people coming up to us to say if we wanted to talk about, our coworker and how we felt about it. But I haven't heard of anything, lately. I know we have the option of maybe going through HR to see if we could, if we want to talk to somebody. but nobody has been active enough to ask me, myself or my coworkers, or I haven't heard any other nurses that I have contact with in the other units to see if we can talk to somebody or if we need help, you know, emotionally at this time. I don't know if in the other hospitals they've had this option, you know, given to them at this time.
And if I could ask a follow-up question, it would just be, I mean, just simple. I mean, it's just what we've seen on TV. I mean, just how are you doing?
Well, I think right now, since I work in a pediatric, you know, I work in a pediatric intensive care unit, our numbers are not as high. And the reason why I believe that that's the case is because the schools are closed. I mean, thank goodness that they're doing, you know, school via home. But I know that I've talked to fellow nurses in the adult units, and they are emotionally taxed. And like I said, they're physically taxed. There's not enough nurses to take care of all the patients that are coming in. I know the day of the court's decision, I believe there was like 1,150 new hospitalizations around El Paso. So that's a lot of, that is a lot of patients for the few nurses that we do have per hospital or per units. And I know that a lot of the nurses, or some of the nurses, I wouldn't say a lot, but even though we do have the FEMA nurses coming in to help the adult units, they're being overtaxed with other responsibilities as charge nurses, as, you know, I think initially when they were opening the units, they were, one charge nurse was initially in charge of like 3 different ICUs. I think that presently they're making changes to help them with that, but it is very taxing for, I've been talking to them. I can't even imagine, because even like I said this weekend when I took care of COVID patients, I was overwhelmed with everything, you know, physically, emotionally. I just can't even imagine that they have to, you know, 2 or 3 patients that, you know, or over that, that these patients are really sick. I can talk because, I can speak because of the patients that we have in our unit. They require a lot of medications for blood pressure, for heart, you know, a lot of drips. It's very hard. It's very hard. And like some of the nurses that spoke, you know, you talk to them initially, and then the next thing you know that they're intubated. So it really has taken a toll on a lot of the nurses, of all the nurses. I don't know.
Thank you very much, Idali. Oh, go ahead, Juan.
I didn't want to cut in, sorry, but you know, the question about counseling, it's already a struggle just to get adequate supply of PPEs, but much less is to get counseling. You know, you know, we're supposed to be tough. We're the heroes and everything else, but you know, you get a pat on the back. You know, you get some cookies here and there, or a little. They left you some pizza for the morning shift, you know, because we're the heroes, you know. But, you know, at the end of the day, I come home and I bring all my grief and what I've experienced in the COVID unit, or from what I hear from other people, and I bring it home, you know. And the counseling comes with family, you know. Thankfully, I got a great wife, you know, that hears me out. You know, that's my counseling. I'm not going to get it at work.
Thank you very much, Juan, and for these questions. We have, let's see, time for 2 more questions. So we'll ask Eleanor to go, and then after Eleanor, we'll ask Anastasia to ask a question after that. But again, thank you guys for joining.
Hi, this is Eleanor. Can y'all hear me? Okay, thank you. Yeah, so I wanted to ask about today's upcoming court decision that's expected by the end of the day from the Eighth Court of Appeals. Obviously, they could decide to, permanently halt Judge Samaniga's order, or they could allow it to remain in place. I wanted to get y'all's reactions to those two potential outcomes. What is at stake for El Paso if Judge Samanigo's order is halted completely, not just temporarily like yesterday? And on the other side of that, if it is allowed to stay intact, what do you think that does mean for El Paso, and how does that impact y'all's lives? Thank you.
Thank you. Maybe perhaps we'll have Councilmember Anello give a few thoughts on this first.
Yeah, thank you so much. So I know that everyone here is going to talk about that in a little bit more personal medical response. So I'll take it kind of politically, but I think it's important to remember that the court and any judge is going to do their job, and they're going to make a decision based on the law, right? And the question at hand is not what is the moral obligation of the court, it is what the legality of the order versus the governor's order is. And I think that's a part of what we're trying to say, right? The idea that some of our elected officials in Austin, who are 600 miles away, would even join a lawsuit that impacts this community so much and make that a question, right? It should have never got to this point. We should be allowed to make the decisions for our community that are important for our community, that are important for our health workers. And you have top level officials sending this to court saying, now you all have to make this a legal decision based on the law versus a decision based on what's going to keep our community safe. And so, if the court does overturn Judge Samanigo's decision because they do not think, the technicality and the wording is legal, it's going to be very negatively impactful for this community. And it's going to be negatively impactful for municipalities across the state during COVID and other issues on really what they can do when it comes to emergency orders. And if they decide that this is legal and they uphold it, that is a huge win. I mean, there needs to be a conversation across this state about who is determining what the need in these communities are. And so with that, I will definitely let the medical professionals go a little bit deeper into that, but thank you for the question.
Thank you very much, Council Member. We are here, I'm getting a time check notice here that we're well beyond our time allotted here. And so we'll have maybe one more last question from Anastasia. Thank you.
Can you hear me? Yes, perfect. Thank you so much for allowing me to ask the question. I'm Anastasia Bolton. I work for Tegna in Texas, and Tegna is a media company that runs 11 television stations in the state. There is not one in El Paso, but there are multiple stations across the state. We cover about 87% here. So my question is, and I have many, but since the time, I wanted to ask about rationing care. We've heard about that in places like Italy early on in the disease. Could you please elaborate on that and how many, if you even know, if you witnessed it or anecdotally, how many times that has happened? Because it feels like we should be sort of over that already, right? We should have learned, it feels like, lessons from 6 months ago.
Thank you very much for that question. It's open to anyone to answer.
You're talking about the rationing of supplies, you said?
No, I'm talking about the rationing of care. You mentioned that a FEMA nurse told you.
Yeah. Well, yeah, I guess, yeah, they had mentioned that it's worse here, I guess. I'm not sure Yeah, they said it was worse in New York, but I guess because we're kind of short on our supplies and how should I say it? I'm not sure for. Oh yes, the thing is, like running out of ventilators and the thing of having to use BiPAP machines. BiPAP is like the last resort before you use a ventilator. Also, oh yes, like I had mentioned before, that we were using. Okay, so like towards the beginning of all this big crisis, this big spike that we had, we were just using private rooms. And then all of a sudden, when it started really peaking, and there was nowhere, we were running out of space, the capacity. That's when we started converting those rooms, or this hospital converted the rooms to semi-private rooms, just to shoehorn in more people, more and up the capacity. And so that's, I believe that's part of like what they hadn't seen in New York. And but Las Palmas, we don't have like some of these other hospitals, or especially our county hospital, where there's the whole tents being put up to house patients. And the thing about having to use ventilators is that, having to ration out the ventilators, who's not doing so well. Maybe we should discuss with the patient's family, they're not going to do well. Maybe we should extubate, and see how the patient does, or maybe they're not going to do well and they should withdraw care. And that way, the ventilator can be used for somebody else, where they decide, this patient has a better chance than this other patient. That's scary, especially if it's your family member. I think that's part of like what that nurse was telling me about, that, some of these decisions that are having to be made for the care of some of these COVID patients is maybe different from what they experienced in New York. Yeah, it's just disheartening, the lack of the stuff that we need. We certainly we're glad that FEMA had come in and are helping us out. But you know what? We also need PPEs. Adequate supplies. I'm hoping that answered your question.
Thank you very much, Juan. Thank you very much, Juan. I know, Stephanie, you've had your hand up, so we'll have you ask your follow-up question as well before we wrap up. Stephanie, can you hear us? I believe you're still on mute. If not, then we'll see if Anastasia has a follow-up question. Anastasia, you're up.
Thank you. Can you hear me? Yes, awesome. Thank you. Yeah, I was going to ask a follow-up to my question. Maybe the easier way to ask what I was asking is to the nurses on the call. Are you guys having to make decisions between who lives and dies at this moment?
I would want to say that I don't work in a critical care unit right now. I have before, but this is pre-pandemic. So on the medical surgical, we transfer care if patients start to deteriorate and require intubation. We'll run a code and then they'll get transferred to either ICU or just a higher level intensive care unit. So I have not personally witnessed that, but I don't work on an ICU unit where it would be where they would be making those kind of calls. I hope that answers, like, on my side. I'll let someone else answer.
Yeah, I also work med-surg, but I get floated to the COVID unit. But like what my fellow nurse said, that I don't work critical care where I see people intubated.
I work in a pediatric ICU at this time. We are not rationing care at this time, but I don't know about the adult ICU. I know that every single time that I work, I hear multiple codes or code blues. So I couldn't answer that question, Anastasia, with certainty for the adult ICU.
Thank you, everyone, for joining us here today. A very important momentous occasion to help keep our community safe. Again, those of you in the media, those of you on Facebook Live, thank you very much. And you guys have a good day.
Will Dupree here again in the KXAN live studio. That was the conclusion of a virtual news conference held by National Nurses United, which is a union. And you heard from 3 registered nurses who work in hospitals in El Paso. Their main message was really criticizing the 8th Court of Appeals here in Texas for temporarily blocking the El Paso County judge's shutdown order. He had issued an extension earlier this week, and it was supposed to stay in effect until December 1st, limiting non-essential services because of the situation in terms of new COVID-19 infections in that community and hospitalizations from it, which is really affecting the capacity at those medical facilities and really worrying a lot of people there. However, that appeals court yesterday, in a decision 2-1, said that the order would be blocked temporarily, and permanent final decision should be issued later today. So we, of course, will keep tracking that. But those nurses that spoke were saying how disappointed they are in that court, as well as the governor and state attorney general. One of them even calling them accomplices to this tragedy. That was his words, describing their participation in really criticizing the El Paso County judge for issuing that stay-at-home order at this time when those medical facilities are really struggling with resources and dealing with a lot of patients who have been diagnosed with COVID-19. Just for a little bit perspective's sake, so again, that was from the nurses in El Paso talking and sharing their thoughts about that order being temporarily blocked by the El Paso County judge. Just for a sense of what that situation is in the community, I want you to take a look at these numbers really quickly. This is from the city of El Paso. They reported that 16 more people died and more than 1,400 new cases have been reported, and that is just today, bringing their total active case count to 30,848 in that community. And then finally, some other data to share with the hospitalizations. 1,132 people are currently hospitalized, 317 having been admitted to the intensive care, and then 202 people needing machines to help them breathe. So I just want you to take a look at this number, and we'll really highlight that active case count number and then the hospitalization figures to just show you what is happening here in Austin. So if you take a look here, we only have almost 1,600 active cases. Jump back to El Paso, they have 30,000, almost 31,000 active cases. So again, in Austin, we have 1,585 active cases, 163 current hospitalizations, 57 patients in intensive care, and 28 people needing ventilators to help them breathe. So while Austin is definitely dealing with this crisis, it's much worse in El Paso. So we want to keep that community in our thoughts. And we will also continue to report on the situation there because it really could spell a sign of things to come for the rest of the state if that situation is not in better control. We'll also keep reporting to see what the 8th Court of Appeals here in Texas finally rules about that stay-at-home order. It's blocked temporarily in El Paso, but there should be a final decision announced later today. I'm Will Dupree here in the KXAN Live studio. Thank you again for watching our stream. We'll see you back here throughout the day with additional updates. Please, everyone, take care of yourselves. Stay safe and healthy. Wear a mask. I've got mine right here that I keep and I put on as soon as I get off air. This goes right back on my face so that I can interact with the coworkers who are gathered in our building. Social distance from yourself. If you are hanging out with people that you do not live with directly, make sure you're maintaining that social distance and try not to do that indoors because the chances of spread are so much higher. These things we can't highlight enough, so we're going to do it one more time for all of you. Thanks again for watching. We'll see you again. Take care.